All right, today we're going to talk about a procedure that, millions of people have done safely every single year, the thyroidectomy. But this isn't going to be just some dry medical explainer. No, this is the story of a pretty dramatic revolution, a story about a time when this exact operation was one of the most terrifying things you could possibly face.
Okay, so let's just start with a number that'll really stop you in your tracks. We're talking the 1850s. If you needed thyroid surgery, your chance of dying on the operating table was 40%. Just let that sink in. That's almost a coin flip, and not in your favor. It was an absolute last resort, a desperate, desperate gamble.
So that leads to the big question, right? The whole point of this explainer. How in the world did we go from that, a terrifying 40% death rate, to the incredibly safe routine procedure it is today? Well, the answer is a fascinating story, and it really comes down to meticulous innovation and the genius of one particular surgeon.
Before this revolution, the operating room was, well, it was a grim place. The thyroid gland itself is just packed with blood vessels. So without the techniques we have now, surgeons were just dealing with catastrophic, uncontrolled bleeding. And you have to remember, this is before we really understood germs and antiseptics, so infection was a constant, deadly threat. You can see why they called it a butcher's gamble. It really was. And then this guy comes along. Dr. Emil Kocher. He was a Swiss surgeon, and he looked at all this chaos and bloodshed, and somehow he saw a way to bring order to it. He is absolutely the hero of our story today, the person who pretty much single-handedly turned everything around. And this timeline, man, it just shows you his impact perfectly. What Kocher did wasn't some flashy new invention. It was a technique, a meticulous, careful, step-by-step process. He would systematically dissect the tissue, and here's the key, he'd tie off the arteries before he cut them. Total game changer for controlling bleeding. And the results? They were absolutely staggering. By 1898, he'd done over 5,000 of these surgeries, and he dropped the death rate to 0.2%, from 40%. That is one of the most incredible improvements in the entire history of surgery, period. So get this, in one of those amazing twists of scientific history, a surgical complication actually led to a massive breakthrough. See, Kocher got so good at removing the entire thyroid gland, his patient started developing this weird new condition. He called it cachexia struma priva. Turns out, what he was seeing is what we now call severe hypothyroidism. By studying these patients, he was the first person to actually prove what the thyroid does for the body, and that discovery, that's what won him the Nobel Prize. Amazing, right? So you see, Kocher didn't just make the surgery safe. He literally laid the groundwork, the foundation, for understanding the anatomy of the neck in a way that surgeons still, to this day, rely on. You can think of his legacy as the first real roadmap to this very treacherous part of the body.
And you can think of this as the modern surgeon's cheat sheet, really. It's built on more than a century of knowledge that all started with Kocher. Now, these names might sound like just a bunch of jargon, but they are incredibly important landmarks. Barry's ligament, that's the big red flashing light, the high danger zone for the main voice nerve. BR's triangle, on the other hand, that's the safe window, the spot where you can find and protect that nerve. And Joel's triangle, that helps you find the delicate little nerve that controls your vocal pitch. It's not just anatomy, it's a literal map for a safe surgery.
But of course, just when you think you've got the map all figured out, the human body decides to throw a curveball. In about 2% of people, the main voice nerve doesn't take the usual route, it takes a weird shortcut. It's called a non-recurrent laryngeal nerve. And this is the perfect example of why surgeons can never, ever be on autopilot. They have to expect the unexpected and anticipate these rare variations in every single patient.
All right, so we've established that the procedure is incredibly safe now. But that brings up the next big decision for modern surgeons. Once you're actually in the operating room, how much of the thyroid do you remove? Well, one of the biggest changes in the modern approach is that we just don't scoop out single lumps anymore. That procedure, called a nodulectomy, is pretty much obsolete. Why? Well, it turns out the problem often came back, and if you had to go in for another surgery later, it was way, way riskier. So today, the standard of care, the absolute minimum acceptable surgery, is to take out at least one entire half or lobe of the thyroid.
So the big decision becomes, do you take out half, that's a lobectomy, or the whole thing, a total thyroidectomy? And this table really lays out the thinking behind that choice. It's all about if-then logic. For example, if you have just one benign nodule, then a lobectomy is often the way to go, because it solves the problem with less risk. But if you have disease in both lobes, like with Graves' disease, then taking out the whole thing is really the only definitive cure. And with cancer, it's a careful calculation. A tiny, contained cancer might only need a lobectomy, but for anything more advanced, you need to remove the whole thyroid to allow for other treatments down the line.
Now look, even though it's incredibly safe, we're still talking about major surgery. So yes, there are still risks, but here's the crucial difference between now and the 1850s. Today, we understand these risks inside and out. We know what can happen, and we have very clear plans for how to manage them. They're manageable challenges, not terrifying unknowns.
Okay, let's put this into a real-world scenario to make it clear. Imagine a professional singer needs this surgery. For them, a successful operation isn't just about getting rid of the disease. It's about protecting their entire livelihood, their instrument, their voice. So what are the specific risks that they're going to be worried about? Well, for our singer, one of the biggest fears is damage to a very specific nerve called the superior laryngeal nerve. People literally call it the singer's nerve. See, an injury to the main voice nerve might just make you sound a little hoarse, but an injury to this nerve, it's much more subtle, and for a vocalist, it's devastating. It robs you of your ability to project, to hit high notes, to have vocal stamina. It could end a career, even if your normal speaking voice sounds perfectly fine. Okay, so aside from the voice, what's the #1 permanent complication you can have after a total thyroidectomy? It's something called hypoparathyroidism. Here's what happens. Nestled right behind your thyroid are these 4 tiny little glands called the parathyroids, and their whole job is to manage the calcium in your blood. If they get damaged or accidentally taken out along with the thyroid, your calcium levels can plummet. This can mean a lifelong need for calcium and vitamin D supplements. And honestly, this risk is a huge reason why a surgeon will choose to do just a lobotomy instead of a total if it's a safe option. And then there's the one emergency that every surgical team is always prepared for, a hematoma. Basically, it's a bleed that happens in the neck after the operation is done. Now, it is very rare, but it is life-threatening. Why? Because as the blood collects and swells, it can squeeze the windpipe shut. The response has to be instant. We're talking so fast, they don't even have time to get the patient back to the operating room. The surgeon will literally open the incision right there at the bedside to release the pressure and save the airway. It's all about protecting the airway first. So, as we've walked through the modern procedure, the big decisions, and all the risks, you realize it all comes full circle. It brings us right back to where we started. The core principles that make thyroid surgery so safe today, they're the exact same ones that Dr. Coker pioneered more than a century ago. And really, this quote just says it all. This is Kosher's legacy, a meticulous technique, identifying all the key structures, and uncompromising control of bleeding. It doesn't matter if it's 1898 or today. Those are the timeless pillars of safe surgery. It's what took this procedure from a butcher's gamble and turned it into a true marvel of modern medicine.
And that kind of brings us to a bigger thought, doesn't it? This story, the story of the thyroidectomy, it isn't a one-off. So much of the safety and, the almost routine nature of modern medicine hides these incredible histories, stories of struggle, of failure, and ultimately of revolutionary discovery. It really makes you wonder, right? What other things that we take for granted every day have their own hidden, dramatic history?